press conference from the Minister of Health and Social Services, Mrs. Dubé, and the Premier of Quebec, Mr. Legault. Mr. Premier. Yes, hello everyone. And first, I want to tell you that the reason why Dr. Arruda is not here is to talk a little bit about politics and go over the session, so we don't want to mix up politics with public health. So no worries to have. Dr. Arruda is doing very well. So, before talking about the situation in regards to the pandemic, I want to shortly go over the overview of the session that is over today. Despite the pandemic, there's been a lot of work that was done by all the MNAs in the Parliamentary Commission, amongst others, and I wish to thank all MNAs from both the government and the opposition. We have succeeded in having 16 bills adopted, and amongst those 16 bills is number 66, which in the spring was called 61, which is going to allow us to accelerate 180 infrastructure projects. So we will be able to start with them more quickly than we normally would be able to, which will allow to kickstart the economy and to also be able to give the public infrastructures that have been expected for a long time. Perhaps later on we'll have a 17th bill that may be adopted. We worked until 10:30 last night. We had the agreement of the Parti québécois and Québec solidaire, and now we are waiting for the Liberal Party. It is to allow restaurants who wish to deliver alcoholic drinks to be able to do so. We know that restaurants are suffering quite a bit. There are some that have succeeded in giving food to take out. And if drinks could be added to that, I think everybody would wish for that. So I hope that we'll be able to have a 17th bill that will be adopted a bit later on. Now, I wish to come back to the session. A very important moment was the agreement that we had with the FIC, the Federation of Nurses, on the entire normative issues. For the past 9 months, we've talked quite a bit about the fact that nurses work very hard. We need to reorganize the workload first to help the quality of life of nurses. So there's been all sorts of adjustments that were brought, for example, for them to have incentives as well so that the part-time nurses become full-time nurses in order to lighten the load of those who are already working full-time. So that is a great step forward. First for the employees, and we're happy because, as I've often said, they are our heroes of the year. So we'll be able to help them with these new working conditions. And it will also help give better care for the public at large. So it really is a winning situation for all. On the economic front, you've seen that we have been very proactive. We were the province that helped its businesses the most. And when we look at the numbers, for example, unemployment, we can see that it is in Quebec. Quebec is therefore the province that is kickstarting its economy the most quickly. So when we look at the jobs that we had in February, we have recovered 97.5% of the jobs that we had in February. So we have 2.5%, of course, airline companies, hotels, restaurants, jobs where it is more difficult. We also launched our program for greater autonomy. So additional help for manufacturing companies in order to be able to reduce our imports and manufacture in Quebec. Program for the greenhouses to give very advantageous tariffs to greenhouse producers so that we have more fruit and vegetables from Quebec. And I take this opportunity to launch a message to Quebecers. Buy Quebec products. So when you are able to do so, buy products that are made here in Quebec. By doing so, you help the workers who are in those sectors. We also filed our PEV, Plan for a Green Economy, the PEV, P-E-V, is to reach the objective by 2013 of reducing greenhouse gases by 37.5%. And a big part of that is the electrification of transportation. So there will be a follow-up to that in 2021, more trains, more tramways, more buses, more electric trucks, more help to those companies that can electrify. So a great plan that has been pretty well accepted even by environmentalist groups. On the education front, well, listen, the fight and the great victory has been to have succeeded in maintaining our schools open. For me, it really was a priority, I think, for the Minister of Education as well. Yes, there's 1,200 classrooms, the equivalent of about 3% of students where they're not going to school. But it remains that 97% of children are at school, and that is so, so important. Yes, for their learning, but also to be able to meet with their friends and have a social life, generally speaking. I wish to end by thanking the three leaders of the opposition. Sincerely, Quebecers were expecting for us to be able to work together, and we did work together. We will continue doing so in between the two sessions. So as I was saying this morning, I will have a call every week with all three opposition leaders. First, to inform them of the latest developments, and second, as I did before we had the question periods in the springtime, to be able to also receive the proposals and recommendations. And I can tell you that in the spring, a lot of their proposals were used and were implemented. I'd like to also talk, now, about the pandemic. We have a situation that remains difficult. It looks like I have a hard time saying that word, difficult, so difficult. But I still wish to say to Quebecers that every effort that we've made so far, particularly since the 1st of October, these are efforts that have given us something. And when we compare the situation in Quebec to that of, for example, particularly in the United States, like the northern eastern states, Illinois, Michigan, where it's a catastrophe, if we look at the number of hospitalizations and the death toll in most European countries, even in Germany, that had not been as affected in the spring, well, we can tell ourselves that Quebec is getting through this all much better than the average, and it's thanks to the efforts that we've made. And yes, there are people that are probably not happy that we made difficult decisions, including in restaurants, but it has given us a situation that we have right now. Speaking of restaurants, you saw, I think there was a communiqué that was emitted earlier on, and there's a press conference that will take place this afternoon for the Laurentians. So, you know, the Laurentians, there's a lot of tourists in Saint-Adèle, Saint-Sauveur, Mont-Tremblant, and we've seen in the past few days an increase, a significant increase in the number of cases, and we've also seen the hospitals in that area, particularly in Saint-Jérôme and Saint-Agathe, that are now overloaded. So we announced earlier on that two areas, the Laurentians and the Pays d'en Haut, are going to red zone. It has to be understood that the following weeks are going to be critical because every year it's always difficult in January. So imagine this year with the pandemic on top of everything else. We cannot take any chances. We have to, in January, be able to have as few cases and as few hospitalizations as possible. And now there's a great opportunity that is a little bit of a natural opportunity over the holiday season because schools are closed down, so is construction for a 2-week period. A lot of businesses give a week or 10 days off to their employees. So it's a great opportunity to be able to break the wave. But the people who are on vacation can't start gathering because then all of that potential would be cancelled out. So as I said earlier on this week, we've asked police officers to be more present, to give tickets And there's one point in particular that I would like for us to say as a message. I'm told that, unfortunately, there's still a lot of office parties going on. I understand, it's fun, you're going on vacation, you're going to have time off, you feel like having a drink together, all the employees. It's not the time to do that this year. So no office parties. Another question that many people are asking themselves and that we've been asking ourselves for the past few weeks, are we going to be adding restrictions? I wish to say that at the beginning of next week, we will be making a decision to know whether we will be adding any further restrictions to the ones that we already have. And I would like to end by saying, and it's a nice image that Christian often uses, a marathon. In a marathon, the most difficult are the last kilometers to be run. So we are now in those last kilometers, so it's worth continuing making efforts so that we have as many people as possible cross the finish line. We see the light at the end of the tunnel, and Monday we are going to start vaccinating the first people in Quebec. So that is a very important step. Of course, not everyone is going to be able to be vaccinated in the next few days or weeks. So we have to be patient, we have to be prudent, and I think that it is worth making those efforts. Otherwise, I know that for some people, some of the journalists, that it's perhaps the last time that I see you this year, so I wish to take advantage of this opportunity to thank you for the work that you do. It was something that was took a lot of time for Marco and all the journalists, and I know it was very demanding. I know that there were some moments that were more difficult because Quebecers heard your questions. That was new. There are some that found that you were hard toward me. I want to tell you that I don't find that you are harsh with me. I have to say I'm used to it. But sincerely, I want to thank you because when in March, or no, not in March, in May, when we had a survey or a study that was made from cell phones to see in the 60 states and provinces in Canada, the U.S., which state or province respected the guidelines the most, it was in Quebec. And I think that you can take a good part of the merit for that. It was thanks to you if Quebecers respected the guidelines. And so we minimized the negative impacts then. English?
The pandemic remains our priority, but we've also been able to move forward on many issues in recent months. We've passed 16 bills, including the Bill 66 on infrastructure projects. I want to thank all the members of the National Assembly for this. The virus has been gaining ground in Quebec in recent weeks. This doesn't mean that all our efforts haven't paid off. We're still doing better than most places in North America and Europe, but we have a few very important weeks ahead of us. If we want to reduce the contagion, we must reduce our contacts. We're already closing schools for the holiday. Most construction workers won't work for 2 weeks, and many businesses will reduce their activities. This will reduce contact and give us a chance to change the situation. But if people organize gatherings, it will ruin all the effects and all our efforts. So we'll punish those who don't follow the rules. We're evaluating whether we need to add restrictions. We'll announce our decision at the beginning of next week. But one thing is certain, the greater part of the answer is in our hands. So, thank you.
Merci, le Premier ministre.
Thank you. The Premier and the Minister for Health and Social Services will now be answering questions from journalists. On this thought process that is still ongoing about the possibility of adding to the present restrictions, I understand that right now, we've talked about it already a little bit, public health is doing an exercise in order to do a more tailored lockdown to see which sector of activity should be closed down in order to really have a concrete impact on the reduction of social contacts as well as to limit the spread of the coronavirus. From your point of view, have you already pretty much done the work that needs to be done before this? For example, plants. Is it necessary to close them down, or can we just, close down malls, for example? Well, first of all, I have to tell you that I have a meeting this afternoon with public health in order to, in fact, go through the different sectors. I think that Christian has already started doing so. So that means that there is no decision made so far as we speak. But yes, in fact, it is what we've been trying to do with public health. That is identify which are the places where there's the most outbreaks, which are the places where an action or a restriction might reduce the number of contacts and therefore the number of cases. I'd like to remind you, because we've talked about it a lot this week, that public health, its role is to emit recommendations of us, and the role of the government is to make decisions. So we will make those decisions and we will announce them to you at the beginning of next week. Now, you saw the refusal of insurance companies of offering underwriting in Indigenous communities without even analyzing the file. I know that you don't want to play with words, but is that systemic racism, and what are you going to do to fight it? Well, first, it's unacceptable. It is unacceptable. It is a real problem. Even if they are private companies, it's a real problem, and we're looking at different solutions, but it is unacceptable.
Bonjour.
Bonjour.
Vous avez parlé récemment des
You recently talked about the doses of vaccines that you are waiting for, and I think I understood that you were expecting 1/3 in March, 1/3 in February, 1/3 in January. I want to know, are we going to be able to deconfine, remove the lockdown once all the vulnerable people are vaccinated? What is the percentage of people that has to be vaccinated before we start opening things up? Well, first, we have no confirmation that it'll be a third, a third, a third. I asked Mr. Trudeau again yesterday, and unfortunately, he cannot answer that question yet. Now, there's a lot of considerations to be taken into account, a lot of factors as will play in the gradual deconfinement. Of course, we will be following the situation in hospitals. So it will be done gradually, and perhaps Christian can add. Also, recall that Dr. Arruda explained quite often that we have to ensure that we have a vaccination rate that is sufficiently high to start having an impact in order to be able to start deconfining. He often talked of 60 to 70% of the population that should be vaccinated before we can deconfine. So, of course, depending on the speed at which we receive the vaccines, that will play. But one thing that is sure is that the first vaccinations are really going to be given to those vulnerable and the health network.
Sur la session en général,
On the session in general, the Protectrice du Citoyen yesterday said that unlike what you said, there had been a lack of material at the beginning of the pandemic. And it's also through Dr. Arruda that we learn the way in which the decision for restaurants and museums was taken. The facts of the past few days, don't they contradict what you said about the transparency of your government? Well, first, yes, I'd like to correct you, but according to me, the public protector has not contradicted us. What we've said since the beginning and what I've repeated the entire springtime is that Quebec, in total, has never lacked any individual protective equipment. But I said often that there were problems of distribution in certain places. And there was a problem is that there were no bosses in certain CHSLDs. And since the fall, there is a manager in each CHSLDs who ensures, among other things, that all the PPE is there and who makes sure as well that employees wear the personal equipment material correctly. So there is no contradiction, unlike what you're saying, between what the public protector is saying and what I've been saying since the spring. Same thing for restaurants. I said many times that I had respected all the recommendations of Dr. Arruda and that in certain cases I even had gone further. So in the case of restaurants, we went further than what had been proposed by public health. So it's quite in compliance and there is no contradiction here.
Bonjour, aujourd'hui, malheureusement, 50.
Today, unfortunately, 53 deaths, which is, I think, a summit since the month of June or something like that, at least many months. With the increase of cases in the past few weeks, one might think that that number will also increase by the end of December necessarily. Well, first, as you saw in the press release, there are a few adjustments to the number of deaths because, unfortunately, we sometimes may end up with a certain delay, but it does not change the importance of the number of deaths of the past few days, whether it be 53 or 48. We're talking about a very great number of deaths. And unfortunately, I would tell you that it follows the progression of the number of cases. Remember that now the average is more around 1,600, 1,700 cases. Of course, the number of deaths is going to be following the number of cases, which is what makes it that our work right now is much more in the residences for the elderly RPAs, because that is where we still have a great number of deaths, even if it is not, or even though it's pretty well controlled in our CHSLDs. So to answer your question, what we'll be doing over the next few days is to continue having a very active way of looking at things and probably to tighten certain measures as far as the RPAs are concerned to make sure that the community contagion is limited in those environments. You talked earlier on about the Laurentians. Now I'd like to talk about the Charlevoix region. Can be comparable. I'm already told that the cottages are all rented. They don't have very many cases, and the cottages are rented by people in red zones. Is that the kind of attention that police officers will be going to, Not necessarily hotels, but we have to remember that we've never forbidden people from renting cottages. I think that is what is important. What is important is to limit the number of places and make sure that people respect their bubble that they have. And we will let people from the Laurentians do their own press conference at 2 p.m. this afternoon, but that is what is different in the situation in the Laurentians, is that there's a lot of movement between the Greater Montreal area because of the proximity to the Laurentians, and we've seen increases in cases that are pretty significant in the past week, plus the entire situation in hospitals, which makes it that we are forced to offload. So there are important differences in the two regions that you've mentioned, and for the time being, we don't see a difference. There's not going to be additional measures, but we have said, and I'd like to end with that there will be police surveillance everywhere.
Bonjour, messieurs.
Hello, gentlemen. There might be a lot of Quebecers, since they can't get together, in residences might opt to see one another outside, perhaps around a fire in a courtyard, have a drink, to hang out for a few minutes. Are you going to invite police officers to be tolerant towards those practices or not at all? Well, the Premier said it earlier on. We are looking at different measures, and I think that there are measures that are restrictive measures that we'll be analyzing over the next few days by Monday or Tuesday of next week. But also we're looking at how we can take into account other external factors that you've mentioned that might allow respecting the health measures, giving people the opportunity of being outside and being able to do so without going against the objective of reducing contacts. So we are working on that, and that is why I think we're both looking at both. We've always said that it's a question of balance, but of course we're looking at every situation by next week. Mr. Legault, I would like to talk about Mr. Fitzgibbon. I wanted to know whether you have ordered him to sell the two companies that are still left to his name. And otherwise, should we understand that you agree to tolerate the fact that he's violating the ethics code until the end of the mandate? Well, first, Pierre has always wanted to sell those businesses, the private equity that he has. So there is no market. It's not like, having shares at the stock market and you can, sell them. He had 13, he sold 11, there's 2 left, and he wants to sell those 2. Now, can we ask somebody what is impossible? That is to sell shares that nobody wants to buy at a reasonable price. That is what the question is that is being asked. I mean, I continue thinking that he may find somebody to purchase, but should we penalize or should we get rid of a person because that person holds shares in a private company, whereas there is nothing that has happened between the company and the government? So there is no, it's clear. Pierre Fitzgibbon has had no advantage. Those 2 businesses have had no advantage. So this morning we were talking about a meeting in Vegas. It's been 10 years that the company in question has been going to that fair in Las Vegas. There are 70 companies that go there every year, and this company in question was there with Dominique Anglade a few years ago. So there is nothing that has changed. This is organized by the government, and it's normal. Every country in the world does that, fairs in other countries, and Quebec companies are invited to go and sell their products. And the minister for the economy, in the case of Ms. Anglade, for example, is there to accompany these 70 companies. But that goes against the rules. I cannot ask for something that is impossible.
Monsieur le Premier ministre, Monsieur le ministre de la Santé, Monsieur Legault.
Je vais peut-être juste ajouter une
And I just want to add one thing, however. It is clear that those companies and Pierre Fitzgibbon have had no advantage since the 1st of October 2018 and will have no advantage by, the fall of 2022. I just wanted to be very clear on that. A clarification. The Fitzgibbon, this is a stain on this session. Well, it's a stain for you. I think that people can understand that you cannot force somebody to sell something that nobody wants to buy. No one can be held to such impossible standards. Let's look at public health. Today, the Minister for Education said today there is no question of closing down the schools. If the cases continue increasing, like the INES has been saying, that is that in regions we may get to a very significant plateau in terms of hospitalizations, could it then be thought of like there are teachers that ask for children to go back home with some teaching material? Well, listen, the 2 places where there are the most outbreaks are schools and businesses. We said what we want to protect most are the schools. But do we want to do something with businesses and schools for more weeks than what we've already announced? Because we've already announced essentially 2 weeks for schools, 3 weeks, I think, in high school, since it's up until the 14th. Do we want to do more than that? That is what we are looking at right now. And in the case of schools, I'm telling you, there's advantages in certain cases that children not go to school. But at the same time, we see that we're at 1,700 cases today. We're almost at 900 hospitalized people. So we have to take measures. Concerning vaccination, in the same train of thought, might you review your priorities and give access to the vaccine more quickly to the staff who works in schools to immunize them, since that is where the outbreaks are taking place? The order for vaccination is established by public health, and we are following what has been proposed by public health.
Vous avez parlé tout à l'heure du fait que dans certaines régions...
You talked about the fact that in certain regions, in certain hospitals, things are becoming more difficult. Could you be more specific and tell us in what establishments the situation is more difficult on the one hand? And on the other, we saw the guideline that was sent to the CEOs of the CIS and CIUS a little bit earlier on this week, and it seems to be the same guideline for everyone. But we know that there are differences between different regions or from one establishment to another, where the vocation is not necessarily the same. Why is it the same guideline that's been sent for everyone, whereas in certain places they say, well, you know, we could have more surgeries here and catch up to the delays because we're not as affected? Well, first to clarify, yes, there's a guideline that was sent, but I mentioned it and I'm going to repeat it because I think that it is important. Before finalizing the decision on the offloading in an establishment or a hospital, the different CEOs have to get back to us with their suggestions for offloading, and we said that we would look that on a case-by-case scenario. So yes, there's a guideline that was sent to everyone, but we have clearly said that we were going to be making a decision that would be appropriate to each region. So it's not, you know, wall to wall. And I want to reassure people, because in one region where there might not be a need for offloading, we'll take that into account as well. So that is very important, because our objective, if there are places where we can have offloading to 30% and in other places we are forced to do it at 50%, we're going to take that into account. So it's not everybody who's going to have the same percentage. The advantage of doing it that way as well, and of having warned people, is that we might have interregional needs as well, because the day that people clearly told us what their own situation was, the number of beds that are already occupied, what they see as a possibility, well, we should be able to use certain regions that are not as affected and having staff, as we did so during the first wave. So I would answer quite simply, it really is not wall-to-wall. We've asked everybody to send us their information, and the decisions are going to be made depending on each situation. Mr. Premier, we saw you concentrate all your energies in the fight against the pandemic in the past few months, so we understand that by the end of the mandate, it'll be your priority, you know, health, but also economic recovery. If we put that aside, if there was only one thing that you wanted to be able to succeed in doing, apart from health and economic recovery, what would it be? Well, first, I was saying earlier on, despite the pandemic, we have done a lot in economic terms and in the education as well, environment, and in the environment. So we've continued going forward. Yes, there are some people who are full-time working on the pandemic, but we have other people who are working in our four other priorities: economy, the environment, education, and culture. We are going to be filing a plan for Bill 101 to modernize it and making sure that it be better respected. So our 5 priorities are still there, and we are going to continue working on our 5 priorities. And despite the pandemic, I'm convinced that we'll be able to keep all of our promises that we gave in 2018, and essentially, they are around the 5 priorities. Inaudible? No, I told you that there were 5. So, economy. So reducing our wealth gap like we did in 2019. We'll keep doing that. And we've already had very great announcements. And I don't know if it's been done, but today we have an announcement of 500 jobs in Sept-Îles. Last week, we announced 600 jobs in Vachères. 2 weeks or 3 weeks ago, we announced 500 jobs in Rivière-du-Loup. Next week, I have another great project, 700 jobs. So we are continuing to make announcements in the economic realm to go forward. The Minister for Agriculture is working on food autonomy. We're going to be filing an environmental plan. It's the first time that we have a plan with numbers, with measures that are financed and evaluated on what the effect will be on greenhouse gases. There's the new Bill 101, new cultural projects, and we're going to continue implementing kindergarten at 4 years of age and renovating and building big, beautiful schools, and we're going to continue building our homes for the elderly. So Quebec continues going forward.
Bonjour, Monsieur le Premier ministre, Monsieur le ministre Dubé.
When we observe the statistics in terms of hospitalizations, I know that it is one of the statistics that you observe with specific attention because it does show a certain level of seriousness. On the 4th of December, we had 754 people that were hospitalized, and it has not ceased going up every single day since the 4th of December. The latest numbers is 171 people, so that's 23 people more than just the evening before. When we look at these statistics and we observe the analysis that Camnes did, saying that in red zones there are strong chances that we are going to go through the capacity of the beds that were reserved for COVID patients, it would seem to be inevitable that the decision that you'll be making on Monday will be of locking down certain sectors. We can't continue if we look at these statistics in the way that we've been doing things up until now. Is that not the case? Well, first, the beginning of the week for me is Monday or Tuesday. So, listen, the situation right now, we cannot tolerate for it to remain where it is. So, you are right that if the situation remains the way that it is, we're going to have to add restrictions unless Quebecers start respecting the measures that are already set up more, because there's still a minority that does not respect the restrictions that are already announced. But yes, in fact, I don't know, Christian, if you wanted to add anything? No, because I think that I would tell you that when we follow the hospitalizations, and I talked about it often, it's not just the net amount. That is, the fact that it's either 20 additional today, 23 to be correct, exact, but today it's 120 more, and there's about 100 that came back out. And that's hard for a network. That means 120 new people that you have to care for in a day who arrive at the hospital, who were not ill before. So that is the big concern. And once again, you're quite right, Mr. Lacroix, that is what puts a lot of pressure on the healthcare system. Now, we also have to think of the fact that we have set up measures to tighten things up, and I'm thinking about big malls. And I think that we should have a combination of factors, and that is why we still wanted to take a few extra days to look at what that leads to. And our PAs, for example, to make sure that the control measures are well set up and followed. So there's a lot of things that we've set up in the past few weeks. We've always adjusted ourselves, but we also have to see how these measures, what kind of effect they have, and that is why we decided to take a few days more. There are many people who have written to me and who are asking whether there's going to be a certain tolerance for people who live alone at Christmas. A lot of people are saying, is the government going to tolerate that a person alone at home be able to visit one family bubble during the holidays? Are police officers going to have some tolerance for that? For example, if a person who lives entirely isolated alone in their apartment might go visit their children, for example, in one family bubble. Well, listen, the guideline is clear, and we are going to have it respected. Ideally, like my mother, who's going to be 92, well, I made sure with my sisters that we're going to go one after the other. We're going to go one at a time. But for the well-being, very often people who are alone are more vulnerable people. So it is better to go one per one to visit them and to be very prudent rather than asking that person to come and join groups in a family bubble.
Patrice Bergeron, La Presse Canadienne.
Bonjour, Monsieur le Premier ministre. Bonjour, Monsieur le Ministre.
Now that we know that in the case of restaurants you went further than what public health had suggested, can we now have a list of all the moments and all the cases where you went further than public health, just to make it clear? Well, listen, as we've often explained, sometimes it's debates, and one of the two parties agrees with the other after having argued and discussed it. I had already said that at the beginning, public health had given us a few days to close businesses and schools, and I had wished for it to be done as of the next day, so we had gone further then. When we closed down restaurants, there was also the museums,
Les salles de spectacle.
the concert halls. So it wasn't required at that time by public health, but it has to be understood that I think it was the beginning of October, end of September, but we judged that it was time to do so, and the future showed that we were right, because in the weeks that followed, pretty much everywhere in the world, they closed down the restaurants, the performance halls, theaters, museums, movie theaters. So pretty much all those activities, pretty much everywhere, are forbidden. So we were visionaries.
D'accord. Concernant la vaccination, dont vous avez-
Concerning vaccination, you talked about it earlier on.
on sait qu'il reste un
We know that there is a part of the population left that, according to surveys, does not want to get vaccinated. They have no intentions of getting vaccinated.
qu'il y a des moyens qui
Are
sont
there any means that will be set up
sensibilisés
to create awareness in those people, to entice them
à aller se faire
into getting vaccinated? How is that going to happen so that you be able to get them to embark? Well, I think that there have been surveys that were made, and I'm not aware of the latest ones. They would have to be looked at, and if we have any other information, we'll communicate it to you. But I think that there is an important number of Quebecers who do wish to get vaccinated. So there's, for things like the flu, I can't compare the flu to the situation of COVID-19. I'm not going to go into that debate, but we still have succeeded. And I'm telling you, as of today, there's already 1.5 million people who have been vaccinated for the seasonal flu in a little over a month and a half. So it's to give you, there's a level of adhesion on the part of the public to the vaccination process. There will certainly be communication campaigns, significant ones, to entice people, because it's not a question of the fact that we won't have enough vaccines. We will have enough vaccines. And just as an example, because we've talked about it a lot, there would have been a much higher vaccination rate in H1N1 if the wave had not stopped, because the progression at that time had been very significant then. So for me right now, it's good to explain and to make sure that we see how the first weeks unfold, but I'm very encouraged by what I've been seeing in discussions that we've been having with the public. But what is important, I would say, is to have it as quickly as possible, because the best evidence is that when we will have vaccinated our vulnerable people and we see how that changes the situation, I think that it will encourage a lot of people to get vaccinated. Yesterday at the Premier's meeting with the Prime Minister, there are some premiers who asked Mr. Trudeau to set up a campaign to explain the importance of getting vaccinated. So Mr. Trudeau said that he would have a look at that. So that could also be a way, depending on what the federal government will see, whether we want to put money in ads as well to explain the advantages of vaccination and, the risks that are non-existent or just about. Mr. Dubé, I would like to come back to the hospitalizations. In Montreal, Ines is saying that the projected number of hospitalization remains high. We'd like to have your reading of the level of risk for the Greater Montreal area, and if there is one, what is your contingency plan? Well, the statistics that I've seen, the ones that were given by the INES this morning, do show a pretty large, a broad, difference. So right now we're at 800, and for the Greater Montreal region, I was even a bit surprised to see that it could be shown as being stable. When there's a stable line that says that it's about 75% of probability, and then it can go down, which is what we would wish, or it can go up with levels of probability. So the simple answer to that is that right now, there's still a significant factor of people who are young who are in the group of cases. And if that continues, this is what might help us to minimize the number of hospitalizations, because as you know, the young people resist much better in terms of this virus. And that is why the INES has always protected itself by putting, a pretty broad scope. I wish it to be as stable as possible, but when I say, like earlier on, with the 1,700 or 1,800 cases that we see, that is why when I see, 110, 120 new people going to the hospital every day, I'm a lot more worried than I'm happy about that situation. So we'll be following that very closely, and that is why in the next few days we'll see whether there's additional measures to be made, and depending on how the range is followed. An announcement that we were waiting for that still hasn't arrived is the one of the report for the Action Group on Racism, which is expected in the fall of 2020. Now we're winter of 2020. So is it going to come after the parliamentary session? It will arrive in the fall of 2020. The fall goes until the 20th of December, if I am not mistaken. Yes, you're right. So, yeah, it'll be fall. No, but there is a report. I've had meetings. We adopted at the Ministers' Council, so beginning of next week. Monday? Beginning of next week. It will depend on the announcement on, the 700 jobs. Very well. No. That'll be later. Or Wednesday? No, Wednesday is middle of the week. Oh, right. So it'll be Monday or Tuesday? All right. English questions now.
Good afternoon. My first question is for Mr. Dubé for the health authority in the West Island of Montreal. It has ordered all nurses to cancel any vacations. Vacations or time off is canceled until the 30th of January, starting this weekend. Are we going to be seeing this in other parts of the province, and is this necessary for this board to do this?
I respect the decision that they have taken, because effectively in the West Island, the situation, especially when you look at the Lakeshore and some of those hospitals, the situation is, this is not what we like, but I think this was prudent to prevent that. And that's the reason we appreciate the collaboration that we had with the nurses over the last 9 months, because this is very difficult right now.
And for Mr. Legault, I asked you the same question last week, but now that we're in a période de réflexion, I'd like to ask it again about your handling of the pandemic, because we had that Actualité interview, but
right.
Whatever. And so
I'm not perfect.
I know. Considering your answer last week that you only had the 2 regrets, now that you've had a bit of time to digest that a little bit, is there anything else that you might have wanted to change throughout this session about how you've handled the pandemic, whether it's messaging or timing?
Yeah, of course. When I see the situation today, I would have done a different announcement regarding Christmas, because at the time we thought that the number of cases were quite stable. It was, I think, November the 19th, but for the next 2 weeks, we saw important increases, so we had to announce that, unfortunately, we won't be able to have gatherings for Christmas. So, of course, it's like the Monday morning quarterback. It's easy after to say I should have done something else. But, of course, if I had to redo the session, I wouldn't have proposed the 2 days on Christmas.
Anything else?
Not for now.
Thank you.
Philippe Autier, The Gazette. Good day. To follow up on that question, it is the end of the year. How have you found being a leader in the pandemic? How have you found the experience?
Yeah, but of course it was a lot of uncertainty. We are both chartered accountants. We like to know where we go, and I can tell you that during the year, especially the first few months, we didn't know where it would go. And of course, to follow up on what I said, at the end of November, we thought that we were controlling the increase of the number of cases, but it wasn't the reality for the next few weeks. So, of course, my year was very different than what I expected at the beginning of the year. I didn't expect to spend more time with Dr. Arruda than with my wife. So, of course, it wasn't what was planned. And I like to have plans and know where I go. We have our 5 priorities. We have all our promises. So I like to have a plan. But of course, this wasn't planned.
And how, on that same theme then, you're still very popular in the polls. You took a little bit of a dip. Some of the other premiers have not done as well in public opinion. How do you explain that? Mr. Kenney, for example, he took a big dive.
But it can change very fast. Mr. Kenney took the gamble that he would be able to keep on controlling without having much restrictions. Unfortunately, it didn't happen. I think that what I've tried to do is to be very prudent, even if I have some owners of restaurants that are unhappy.
Raquel Fletcher, Global.
Good afternoon. I have a few questions about the vaccine rollout. There seems to be a little bit of confusion. You mentioned that the first people to get the vaccine will be on Monday. The CIUS in charge of the Memenides residents said that they will be receiving the vaccine on Saturday. Can you explain how that's going to work? So they'll receive the vaccine this weekend and then they will distribute it on Monday?
Well, we're following that very closely. I think one thing I'll tell you is we'll be able to vaccinate the minute we get them, but we are still dependent on the day it will happen. We follow that. As you know, the logistic is very important to respect that. So I still have the same date, which is Monday for now.
The St. Anne's Hospital, the veteran hospital, the Liberal Party is calling for that to be a priority because, you know, these are people who fought in World War II. In your rollout plan, where does St. Anne's fall in the order of who gets the vaccine?
Well, we don't have a plan for hospital versus one versus the other. I think we're more at looking at the population that have the characteristic that have been mentioned by the SIC, which is the Comité sur l'immunisation du Québec. And those are the rules that we follow. So we're more looking at the people within the hospital than the hospital itself.
Yeah, but I would say, and the reason I know St. Anne is because I'm from St. Anne. The situation is maybe a bit different in St. Anne because it's
Vétérans.
C'est ça. You say that? Veterans. So it's a bit like a CHSLD. So I think we'll have to look at the situation because what I've heard is that there are many cases at the St. Anne Hospital, a bit like in a CHSLD. So we'll look at that.
And that's the reason if this is considered a CHSLD patient, they will be in first order.
Cathy Sonnet, CBC.
Good afternoon. I would like to go back to the question Kelly asked you, the CIUS de l'Ouest de Montréal canceling vacations over the holidays, and the period is December 13 to January 30th, which is a long period. And this is for orderlies and nurses. There are some nurses that are so tired, they are considering quitting. So how important do you have the impression that the CIUS must go back and look at its decision and maybe should back up because
I'll tell you what.
People are tired.
Okay, but in simple, very simple. First, we're asking for nurses to if they can cancel their holiday, we ask them on a voluntary basis. That's the first thing, okay? Because we would prefer that if we need additional, because we have a lack of personnel. This is not news to anybody. This is what we have right now. So the first demand is really on a voluntary basis. If we can't, we still have this arrêté, this famous arrêté 007 that we can use, but we don't want to use it as much as it was used before. But if we have to use it, you know, instead of having a lack of, how we say, un bris de service, you know, a break in services, then we will have to use 007. But this is not what we try to do. That's the reason I'm being clear. If we need to do it, we'll do it, but we would rather function with nurses on a voluntary basis.
Okay. My second question is for you, Mr. Legault. Police officers give a fine yesterday of more than 1,500 if you include all the costs to one visitor visiting a couple in Saguenay, in La Baie. So they are cracking down, but is it too rough for you? Because it gives the impression that they're not fooling around. This is exactly what you wanted, but do you want people to have this anger because now police officers are more than serious?
When we look at the situation in Saguenay-Lac-Saint-Jean, I think that if there's a place where we have to pass a message, it's in Saguenay-Lac-Saint-Jean. So I'm happy to see that police people, they make sure that all the measures are respected.
Visiting a couple?
But you can visit somebody, one, visiting one, not two.
It's rough.
Merci. C'est ce qui met fin au point de presse.
Thank you. This puts an end to the press conference. Have a great day, everyone.
This year, the response